Well, this flu season is on track to be worse than last year. There are ways to keep you and your family healthy.
UI Health is here with tips to help you prevent the flu from spreading and to protect yourself from getting very sick. Dr. Scott Borgetti joins us now with more. Doctor, the flu has ravaged my house or something of the sort. And I feel like it ravaged, I was going to say it ravaged our office. It's everywhere. You turn around, someone is saying that they're sick. It's a bad season.
It is. I will say my own family, we had to rearrange Christmas because, people had the flu. And I think, like you said, it is unfortunately a bit of a particularly bad flu season. This, the flu changes and evolves every year, right?
Sure.
It's one of the reasons we have to keep getting new flu vaccines to try and target whatever the strain is this year. This year there's a variant of the flu called subclade K, which people may have seen in the news or something. I've seen stuff like super flu, ridiculous names. But the point is this season is a little bit worse than the last few. It's the most cases we've seen since 2022. I think my broad point about the flu is always like, the flu's here every year. We get very kind of used to it. Many of us have had it. We know people have had it. But every year, it puts hundreds of people in the hospital, puts people out of work. Even just this year in Chicago, 150 Chicagoans have ended up in the ICU from the flu. So just to remind you, we're very used to the flu. We're pretty desensitized to it, but it is a serious thing, and you do want to think about it, especially this year.
I mean, and this is where your specialization comes in, because it's infectious diseases. So we want to do everything you're doing, because I know you know everything about the flu and the cold. I mean, tell us, what are some tips that we should be doing to protect ourselves?
Yeah, absolutely. I mean, it is honestly stuff you guys probably already know, right? So how do you get the flu? So when people who are infected cough, sneeze, breathe, talk, the little respiratory viral particles kind of fly into the air. If they land on you or on a surface that you touch, and then you touch your face or your mouth, that's how you get sick. So your strategies are going to be based around how to prevent that from happening. So one, wash your hands, right? If you touch something with the flu and then you wash your hands, you won't get it. Especially if you're in a busy place, crowded place, public place, etc. Masking, this isn't like the heart of COVID where we need to mask everywhere we go all the time. But I think if you're a person who's older, maybe has pre-existing medical conditions and it's at higher risk of getting really sick if you get the flu, it's reasonable to think about wearing a mask in crowded indoor spaces.
Do you mask on a plane?
I do when I go to the airport specifically, because again, you're just around a lot of people, and this time of year, there's just a lot of viruses going around. I probably wouldn't necessarily do that in the summer when there's less activity. And then if you are sick, stay home from work, ideally. I know it's really hard for all of us who try and power through and go into the office. Most recommendations are stay home until you're fever-free for about 24 hours. And if you are going to go in, you should also wear a mask when you're sick, right, to keep other people safe. Not necessarily to protect yourself from further things, but to keep others safe. And then the last thing is, of course, probably our most potent tool even this year, which is the flu vaccine. I think people have heard, the flu vaccine is not a perfect match for the flu strain this year. And there is some truth to that, but even with that said, there's already studies coming back from this flu season that while the vaccine's not 100% preventative, you're never gonna get the flu if you get the vaccine, it will absolutely dramatically lower your risk of getting really sick. So more mild symptoms, keep you out of the hospital. So definitely we should get our vaccines.
All right, quickly, for all the grandmas out there, if you go out the house with wet hair, will you get the cold?
That does not cause the flu. Being cold does not cause the flu. It's the virus, right? Ultimately, that does it.
But also, you have some tips on things because there's a ton of medicines in the aisle, and they're herbal, remedies. Do they work?
So there's vitamin C supplements. There's different things that people will try. There's always at least a little bit of science behind all these things, but I think the bottom line is that there's not strong evidence in any scientific studies or something that if you take some vitamin C during flu season, you're not going to get sick. So I usually say if it's safe and cheap, reasonable to take a supplement, but you're still going to want to do those other things that are more tried and true.
And same for a zinc tablet too?
Yeah, I'd probably put those kind of in the same category. There's some biological reason they might help, but they're not going to probably be a silver bullet.
I bought a Costco size of that stuff.
Exactly.
Oh gosh.
They got you.
Oh my goodness. Dr. Borgetti, thank you so much for being with us.
That was great.
Really appreciate it. Thank you so much. For more information, just head to uihealth.care.